2013 World AIDS Day has highlighted the issues around the dispensation of chronic medications such as ARVs. Now, Chilisoft's implementation of Microsoft technologies has allowed them to create an innovative solution called ReMed. Here to tell us a bit more about it is Chris Ainslie, the Business Development Manager at Chilisoft. Chris, thank you very much for joining us this morning.
Thank you. Thanks for having me.
Tell me a bit more about the company. I understand that you are a software development company and you've utilized Microsoft technologies to bring forth your innovations. So how does the company work and your relationship with Microsoft?
Right. Well, at Chilisoft, we believe that when we're creating software, we need to create software that makes a difference to people.
Yeah.
Everybody is subjected to using really boring software in their jobs every day. We try to create software that's really human-centric, easy to use, and it adds business value. So ReMed is exactly one of those pieces of software. Microsoft recognized that when they were looking for partners for the Equity Equivalent program back in 2010. And they selected us as one of 4 companies out of 700 odd applicants to join the Equity Equivalent program,
Yes.
which has helped us to build training, to grow the company and to scale into new markets.
Okay. Now, through EEP program, Chris and his team were able to create this ReMed, which is a software program that aids in the dispensing of chronic medications in hospitals. Just a bit of an explanation. Take a look at this.
We wake up 4 o'clock and we're going to take the 2 taxis to the hospital. Maybe we take 2 hours to drive to hospital and we're waiting for the collecting the cards. We're also waiting another queue to see the doctor.
Everything done in the pharmacy was manual, so obviously your waiting time was quite high. There were certain days where the patient load was so great that we had to actually turn patients away.
Eakendale was often in the headlines and in the news for all the wrong reasons. Chillisoft is originally from Pietermaritzburg and Eakendale is on our doorstep. We felt that it was our turn to give back to the community and we were confident that our solution would be able to add immediate benefit to Eakendale.
We chose to use a Windows client-based solution. When the patient comes in, they've already got the screen open where the details can be looked up. They can immediately see their previous prescription, and with pressing a few buttons, they can dispense that and print out the labels.
They don't have to wait as long in the queue because the entire dispensing process is now speeded up. The labels that they receive on the medication is clear and legible, which leaves you more time to counsel the patients, to monitor their adherence, to monitor regimen changes. It's overall a much better experience for the patient.
I was so happy because I didn't wait for so long. I wait for 15 minutes, 30 minutes, I get all my medicine and I go home so quickly.
The impact on the community is massive in terms of just being able to go and collect your medicine on the day that was scheduled. It makes a huge difference to somebody's life.
So, Chris, I think we have a better understanding of what ReMed is. But tell me first about how you got involved in this project.
Right. Well, back in 2006, Eakendale Hospital in Pietermaritzburg was in the headlines, but for all the wrong reasons. They had tried to implement a hospital management system, and that project had failed. Government had just announced the rollout of the free ARV program. And queues in the pharmacies had tripled. There were hundreds of people waiting.
Yeah.
People were coming in at about 4 in the morning waiting to get their meds, and often coming back the next day because they still hadn't been served. So we decided that we could make a difference here.
Yeah.
Create some software to help, just in the pharmacy, help these guys to dispense their medications, get it out there, and help the community.
Yeah. So once we try to get to understanding the human-centered approach of the software that you designed, how exactly does it differ from other hospital systems?
Well, your typical hospital system requires mature processes throughout the hospital, right from patient admission through the entire system. Now, in our government hospitals at the moment, we don't have that. We have very paper-based manual systems. And if you try and implement a hospital management system that requires all of this infrastructure, computer literacy, a whole lot of things like that, you don't have a system that actually can really help and work in that environment. ReMed just does what it needs to do. It sits in the pharmacy. It is connected to the electronic drug list, which is published by national and provincial health. So all of your codes, all of your medicine codes, your regimens, all of that stuff is pre-populated. The system goes in, in a day it's installed, the users are trained, they're up and running, and users, as in the pharmacists, as well as your patients, are seeing immediate value.
Yeah. I'm sure putting all of this together must have been quite a challenge, and I'm sure there were numerous others in the process of creating ReMed. Tell me about those challenges and how you worked your way through them.
A lot of the challenges related to computer literacy and infrastructure. If you think of a rural clinic that's out in the middle of nowhere, they might have one computer and somebody who doesn't really know how to use it, they've got no internet connection, no line, anything like that. Most of the systems out there they require this big connection back to a big infrastructure. ReMed doesn't need that. So we understood the environment really well and then built a product around exactly that.
And tell me about how you see this changing communities going further. I'm sure there are many success stories that you can tell me about where you've seen the actual results and the effects of ReMed.
Absolutely. As I said, you had guys who were waiting a full day, every day, once a month, to collect their meds. Guys can come in and collect their meds in 20 minutes.
Yeah.
They're in, they're out, and it's done. The process is so much faster, and obviously that has a huge knock-on effect to the community. These guys are now able to, they don't have to take a full day off work. Yeah. They're able to come in, get their meds, leave. There's an economic benefit to that. There's a quality of life benefit to that. Yeah. So the community has now got all of this extra time, and 18,000 patients a month just in Edendale Hospital are now able to come in, get their meds, and leave. Makes a huge difference.
That does make a huge difference. And on that note, I want to ask you, I mean, to all like-minded innovators out there in South Africa who feel there are challenges that they'd like to address given their skill set, what would you say to them, and how do you encourage them to, go forth and take on new worlds like this?
Really just look for the opportunities. The opportunities are everywhere. You look for the opportunities, get in with the customer, and that just requires a meeting. You, for example, in a hospital. Yeah. You don't need to go through all of these cumbersome processes. If you identify an opportunity, go and meet with the client, figure out, okay, what can we do to solve a small problem for you? Let's just solve that little problem. We don't have to have a multi-year, multi-million rand project to make a difference.
Fantastic. Chris, thank you very much for joining us this morning.
Thank you.
And congratulations to you and your team at Chilisoft.
Thanks very much.
And if you'd like to find out a bit more about Chris and his team and what they do at Chilisoft, you can also go to www.chilisoft.co.za/ReMed.